Hello, I hope this finds each of you well. I wanted to thank you all for participating in the discussion board last week. Enjoyed getting to know you a little bit better. The introductions were necessary to help us know who's on the other end of the keyboard as we type. Looking forward, we'll get into the content of our class this week and establish a trauma-informed lens. I really think, given the research that's emerged over the past 20 years, that having a trauma-informed lens, trauma-sensitive lens, in working with clients will help you to better diagnose, better treat, uh, and produce better outcomes with your clients. So I'm looking forward to our time together. So let's go ahead and get started. I started off with this slide with trauma-informed care, and it's talking about shifting a perspective. So what is it when people go to therapy? What is it that they get asked? I mean, therapists, somebody comes in and is sitting across the table from you. What is it typically that gets asked right up front? If you said, what's wrong, or what problems are you having, you'd be correct. And so we're trained to diagnose, especially, with managed care. We're trained to diagnose right off the bat. So we're looking for problems. We're looking for deficits. And what's wrong? Whereas if you're using a trauma-informed lens, it changes the questions up front from what's wrong with you to what happened to you. So keep that question in your head as we go along and as we proceed throughout the course. And so as we address overcoming childhood trauma, we'll look at it throughout the lifespan, but we'll go all the way from birth a little bit. We'll talk about even prenatal care. So thinking about this little baby that's on the screen and has this unlimited potential, the times and the experiences that we have, what we found, tend to have quite an impact. So if you're a nature versus nurture person, you'll probably gather some information and be able to maybe make a little bit different discernment about nature versus nurture as we go along throughout the course. I asked this question because in the state of Oklahoma, where I live, we started really becoming aware of trauma because we were sued. We were sued because 9 children died while they were in state custody, and so it was a class action suit. And we were forced to change the way that we were treating children that were in state's protective custody. And so what happens that children are placed in custody? Let's think about some of those things. And so if we look at the ACE questions, and so we'll talk about ACE. ACE is adverse childhood experiences. If we look at the ACE questions, we'll see that there are probably some commonalities that emerge. And so if you read through number 1, you'll notice that looks really closely resembles emotional abuse. Looking at number 2, you'll see that could qualify as physical abuse. Reading through number 3, those situations have to do with sexual abuse. Number 4, it really looks like emotional neglect. Number 5, if you read there, it really looks like physical neglect. Number 6 affects many of us. In Oklahoma, over 50% of marriages end in divorce. So you see a separation from a parent. And we'll talk explicitly about number 7 later on in the course, but that very clearly resembles domestic violence. You can see number 8 has to do with parents who are addicted to substances. And you see number 9 involves co-occurring disorders, comorbidity, mental illnesses, significant mental illnesses. And then number 10, talking about going to prison again, this is separation from a parent. So if you read through this questionnaire, you give yourself a 1 for any question that you answered yes. Give yourself a 0 for any question that you answered no to. You add these up, and these become your ACE score. And so you're like, well, ACE score, this looks like it's very psychologically bent and counseling oriented. But what does this mean? What does this mean? In the late 80s and early 90s, when this study began, researchers weren't sure what it meant. Now we have a very clear view of what it meant. So this actually began as a part of the Kaiser Permanente insurance group in California. And so there was a researcher by the name of Dr. Vince Felitti. He's an MD, medical doctor, was studying weight loss in people that received that insurance, and was noticing some trends. He noticed some people would do really, really well in taking off weight, but then after a while, these folks began to drop out of the weight program, put back on their weight. And so he started doing a series of individual interviews with patients, trying to figure out, hey, what's going on? You know, kind of a qualitative study, so to speak. And so looking at the weight program, he began to notice a trend emerged, a very striking trend. It seemed that each person he talked to had experienced some sort of sexual trauma in their past. And so because of the numbers of people and almost unanimous sort of reporting, he thought something was wrong. And so he called in some other folks to help him do research. And so the CDC got involved, Center for Disease Control. Dr. Robert Anda came on board with the research, and they put together a questionnaire. And so the questionnaire is actually over 100 questions, and those 10 questions that you just read were interspersed throughout the 100 and some odd questions that they actually gave to their sample. They sent it out to 25,000 recipients and received about a 17,500 total number of surveys back, which is a really good response. Anybody that's done survey research knows that that's a really, really high rate of response. And some patterns began to emerge, and they started really looking at this data. When they received the responses back, they noted that this was a fairly advantaged population. Most people had graduated from college. People had good jobs. I mean, income was above the national average for sure. Out of these 17,500 participants, so they were about 80% white, 10% Asian, 10% black, and you saw a pretty good representative sample of people that were were decently well off in California. And they found some very striking numbers, some very striking findings. Before we get into those findings, and we think about all these 10 things that we just talked about, all these things involving caregivers, a lot of things that could maybe get you taken away and put in state's custody. What did all those events have in common? If you go back and you analyze and you pause this video, you'll notice that in each one of those events, a primary relationship was broken, meaning with a caregiver. So thinking about that and keeping this in your mind throughout the semester, how might this affect future relationships? So this whole course is kind of built on what's happening in infancy, childhood, adolescence, and then what can we expect into adulthood. And I posted some things about Oklahoma in here, this Oklahoma Pinnacle plan. That was our response to the lawsuit. We put together a comprehensive plan to treat our children better. And you can see at the bottom corner here, they started noticing that the higher an ACE score was, the more likely that people were to experience all these different problems: HIV risk, heavy drinking, cardiovascular disease, cancer, separation or divorce themselves, life dissatisfaction, mental health conditions, hopelessness, mental health treatment, anxiety. What they found is that the higher the ACE score, the more significantly impacted people were by these events. You're welcome to follow the link at the bottom of the page for a look at the actual study. These links are to Dr. Felitti, who actually talks about conducting the study and the results. And so here's what we found. Just like smoking a pack of cigarettes, or the more cigarettes a person smokes, the higher the likelihood of cancer. This is now the number of ACE events that have happened in a person's life and their likelihood of smoking. So you see people with 0 ACEs have about a 6 or 7% chance of smoking, 6% prevalence, versus about 17% of the population who've had 6 or more tend to smoke. So you're like, yeah, that's interesting. You'll notice something very strongly correlated with that research, which is cardiopulmonary obstruction disease. About 7% of people with 0 have COPD versus people with 4 or more, about 17%. And that's an eerie correlation. Childhood experiences and adult alcoholism, you see the same thing happen. About 3% of the population who has had 0 of these adverse childhood experiences is an alcoholic, versus about 16% of people who have experienced 4 or more of those categories. Same thing follows through with other substances. You notice, and this is not actual rates, this is increased risk. And so you see the increased risk of becoming an IV drug user is about 1,300%. That's 1,300% more than somebody who has experienced 0 ACEs. That's with 4 or more. And you see the same stair step, progression. Rates of depression are very similar. You see a much higher rate in females, and so you can debate why that is, but about 58% of females that have experienced 4 or more experience depression at some point in their lives. About 35% of males. You can see the same thing with suicide attempts. Suicide attempts with 4 or more is about 1,300% compared to people who have had none. This transcends into financial stability and work performance. So you can see that absenteeism, serious financial problems, and serious job problems are also very strongly related to adverse childhood events, the number of adverse childhood events that happen to people as they're growing up. And like the slide before alluded to, the relationships, how might this affect future relationships? You can see intimate partner violence. You have a 500% increased risk of being in an IP violent relationship. You have a very high rate of promiscuity, about a 600% increased chance of having 50 or more sexual partners. And you look at failed marriages, and that's almost a 400% increase from people who've had 0 compared to people who have had 5 or more of those categories. Domestic violence, same thing. Incidence of rape, again, increases almost 900% with 5 or more. So why is this? Why does this happen? So they put together, over the years, there's been a lot of research come together, and especially from other disciplines. I did a EBSCO host search on the ACE study and came up with over 100,000 hits, adverse childhood experiences. So people have really taken note of this. Other disciplines have taken note of this. This is carrying a lot of weight. It's starting to influence policy, and has over the years. But you'll notice the pyramid at the bottom. You'll notice that the people have adverse childhood experiences, which leads to what we found: social, emotional, and cognitive impairment. We'll talk about that next week, which then leads to an adoption of health risk behaviors. So they found that people tend to adopt risky behaviors after experiencing these childhood events. These adverse behaviors then cause disease, disability, and social problems, and lead to an early death. People who have had 6 or more of these categories on average live 20 years shorter than people who have had 0. You're welcome to watch Dr. Anda's video down here as well. I'll be looking forward to seeing you on the discussion board page. I've asked some questions. First of all, give me your initial impression of the ACE study, and what do you perceive as its strengths and weaknesses. So go ahead and dig into this. And also, if you want to disclose, what is your ACE score? and possibly talking about what ways ACEs have affected you. Looking forward to reading your responses. Please contact me if you have questions.